Good afternoon and welcome. Thank you all so much for logging on to join us today for this important COVID-19 update. My name is Cindy Mers. I am the Vice President of the Suburban Hospital Foundation here in Bethesda, Maryland. My colleague, Kristen Pruski, who is Vice President of the Sibley Memorial Hospital Foundation, is also helping to host this event today and will come on screen in a little bit to moderate the Q&A portion of our session. I want to take a moment to acknowledge the overwhelming level of interest in this event from the members of our community, stretching across the National Capital Region. We are thrilled to welcome more than 2,000 attendees for this session today and hope to be able to share some very important information about the COVID-19 pandemic. Specifically today, we will be focusing on 4 topics: the outstanding work of Johns Hopkins Medicine globally, nationally, and right here in this region; some key scientific and research-based information about the vaccine, including safety, efficacy, and of course, the need to continue public health practices as we move through this situation. We will also talk about our individual response to the pandemic, both at Suburban Hospital and at Sibley Memorial Hospital. And of course, we will be talking about the evolving rollout of the vaccine for members of our community. We know that this last point about vaccine distribution and access is probably the reason that many of you registered for this session today. So before we even get started, let me remind everyone that this is an extremely fluid process. The information that we'll share today will reflect our most current situation as it relates to the availability and distribution of the vaccine. Hopkins and all the other hospitals throughout the region are helping to complement the public health vaccine initiative. And we also know that the distribution plans differ quite widely by state and local jurisdiction. And as you might imagine, there are many, many variables. So on behalf of my colleagues who will be presenting, I will remind everyone that it is always best to consult with your primary healthcare provider and continue to follow updates on our Hopkins COVID website, as well as on the state and the county COVID websites. And we will be providing that information throughout this webinar. Speaking of our presenters, we have an incredible slate of panelists from Johns Hopkins Medicine with us today, including Carolyn Carpenter, who is the new president of the National Capital Region for Johns Hopkins Health System; Dr. Gabe Kellen, who's the director of Johns Hopkins Office of Critical Event Preparedness and Response. Dr. Kellen is also the director of the Johns Hopkins Medicine Department of Emergency Medicine. Representing Suburban Hospital, we have Leanne Sedone, who is the interim president and chief nursing officer, and Dr. Hassan Zia, president of Sibley Memorial Hospital. Before I turn the screen over to Carolyn for her opening remarks, please note a few quick housekeeping items. The webinar is being recorded, and I'm sure you all got a little notice about that just a couple minutes ago. We will have the opportunity to share this video recording with all registrants in the next few days. We'll be sending that out to everyone. We're also reserving time, as I mentioned, for Q&A at the end after the presenters' remarks. Many questions were submitted in advance, but please feel free to use the Q&A feature at the bottom of your screen. I know most people are familiar with Zoom at this point, but there's a Q&A feature at the bottom of your screen, and you can add questions throughout the presentation. And we'll address as many of those questions as we possibly can in the time that's allotted. So at this time, I am honored to introduce Carolyn Carpenter, President of the National Capital Region for Johns Hopkins Medicine. Carolyn?
Thank you, Cindy. I appreciate that. And I'm honored to join you this afternoon to provide you with an update on our work across Johns Hopkins Medicine in response to the COVID-19 pandemic. Let me begin by thanking our donors who so graciously continue to support our work at Johns Hopkins Medicine, Sibley, and Suburban hospitals, especially throughout this pandemic. From providing meals, supplies, and financial support to our frontline workers and to support patient care and research efforts, your contributions have been a lifeline as well as a source of encouragement and aid to all our staff. So our sincere thanks. I have been honored and humbled to have seen firsthand the care and compassion and dedication of our teams at both Sibley and Suburban hospitals. They are shining examples of the incredible value that these community hospitals bring to all of those who live in this region. And as you'll hear throughout today's seminar, these hospitals have the added value of being part of a world-class health system that includes an extraordinary academic medical center. Let me just set the stage with regard to what we will share this afternoon. First, you may have noticed that part of the title of this webinar is National Capital Region. Johns Hopkins Medicine is taking a comprehensive approach and strategy to address and serve the healthcare needs in the National Capital Region. Our goal is to create a truly integrated system of care delivery and seamless integration, coordination across all our network of hospitals, ambulatory sites, and physician practices. Our plans include leveraging the strengths of both Sibley and suburban hospitals, expanding key clinical programs and service lines, growing our ambulatory network, and enhancing the home and community-based services we provide. I'm truly excited that this virtual event is actually the first of its kind for Johns Hopkins, gathering together our National Capital Region patients, donors, friends of Sibley and Suburban to share the key information about COVID-19 and the vaccine. As Cindy has already mentioned this afternoon, we will focus on Johns Hopkins Health System's response to the pandemic, key scientific and research-based information about the vaccine, and Sibley and Suburban Hospital's responses to the pandemic, including resources available and where and how to access information that can be helpful to you as the situation continues to evolve at a very rapid pace. The past 10 months have truly been an incredibly challenging time for our nation, our communities, our employees, and the patients we serve. I am proud to say that Johns Hopkins has been at the forefront of understanding, responding to, and innovating in terms of responding to the COVID-19 pandemic. Certainly, the Johns Hopkins University tracking map continues to provide our local, national, and global partners in public health, as well as the general public, with a reliable, data-driven tool to track the pandemic as it unfolds within the United States. As a matter of fact, that site has had more than 1 billion hits. It has been and continues to be a tremendous resource. We are also helping lead the way and set standards in infection control and prevention with proven quality measures to keep our staff and our patients safe. We continue to follow the evolving expert scientific consensus protocols with organizations like the CDC and, of course, our own experts at Johns Hopkins Medicine. And we are working closely with the state and local health departments and officials across our system in the US and internationally for our Johns Hopkins Medicine entities overseas. Our leadership believes that Johns Hopkins Medicine, similar to other healthcare organizations, is better equipped now to provide sufficient COVID-19 testing, to maintain stocks of personal protective equipment, and to mitigate any temporary shutdown of non-emergent surgeries and procedures. We have innovated and strengthened several components of our healthcare delivery system, including our expansion of telemedicine services. Telemedicine, as you know, took a huge leap forward as a result of COVID-19, and it's transforming how we deliver care. We've gone from about 800 daily cases of telemedicine to 5,000 to 6,000 daily encounters. And we have developed a model to manage patients in the comfort of their homes that has proven very successful. In addition, we've improved and modified the flexibility of the infrastructure within which we work to better prepare for COVID-19 surges. We built flexibility in our physical spaces so that we can quickly and easily convert them to new uses to respond to emerging needs. This includes the ability to more easily convert a room to negative pressure, allowing for expanded use of spaces for patients with COVID-19 to keep them and our staff safe. And now we are at the beginning of the vaccine delivery journey. Offering the vaccine is an important milestone for our country and for our organization. As I'm sure you're aware, we've begun to offer and distribute the vaccine to our employees, concentrating first on frontline employees throughout our healthcare system. In addition, we continue to develop plans and distribute and administer vaccines to patients based on authorization and guidance provided by government officials and in compliance with jurisdictional directives. Johns Hopkins Medicine is following the DC and Maryland instructions and guidelines regarding the distribution of the vaccine to patients. As you're aware, state and district jurisdictions dictate where and to whom we can offer vaccines. Later in this webinar, you'll hear from our presidents of Sibley and suburban hospitals who will cover some details related to vaccine distribution in DC and in Maryland. The information we share today reflects our most current situation as it relates to the availability and distribution of the vaccine. This is an incredibly fluid situation, and Johns Hopkins Medicine is working to address all the challenges related to processes for scheduling and receiving the vaccine at our sites. We are working to distribute the vaccine to all eligible patients as quickly and as equitably as possible. The vaccine is a scarce resource, and it is provided to us by state and local governments. All allocations are based on the population of the local jurisdiction. Our goal across Johns Hopkins Medicine is to work collaboratively with local and state government agencies and health departments to help ensure that all of our patients and staff who are eligible and want to be vaccinated can do so as quickly as possible. Please do note that the hospital's efforts are intended to complement the public health efforts. Our supply of vaccine is a small percentage of the total eligible patients we serve in our community. So while there's an abundance of information in the news about the vaccine, we know there remain many pressing questions about its safety, about its efficacy, about how we should live our daily lives and be changed or not before and after the vaccine. I am so pleased that one of our Johns Hopkins Medicine experts, Dr. Gabe Kellen, is here to provide some of the answers to your questions. Dr. Kellen, as we've mentioned briefly, is the director of the Johns Hopkins Office of Critical Event Preparedness and Response, as well as our director of the Johns Hopkins Medicine Department of Emergency Medicine. Dr. Kellen, we are incredibly appreciative that you've taken time out of your very, very, very busy schedule. And we are so grateful for your leadership during this pandemic. And thank you for sharing key information about the vaccine with us today.
Thank you so much, Carolyn. I want to also recognize and thanks the Johns Hopkins Medicine NCR leadership for their truly roll up your sleeve day-to-day work and guidance to all of us in crafting Johns Hopkins Medicine role and responses to combat this incredibly terrible disease that's wreaked havoc on us and society. So I really do appreciate how much you have stepped to the forefront to make sure we can do the absolute best possible. So I'm going to try and keep my comments very brief so there's time for questions, but I did want to impress upon you a little bit about the differences of the kind of vaccines that there are. I'm going to talk essentially about two of them that you may be offered somewhere along the way. Some of you already have. The first one is the mRNA vaccine that you've heard about, both Pfizer and Moderna. Those are the names. And I'm not going to get much into the science going forward, but this is so beautiful as to whoever thought of this, that they synthesized a piece of RNA vaccine, put it in a little fat bubble, what's called a lipid bubble. You inject it, the lipid helps this get into the cells. This mRNA is not replicable, doesn't go into the nucleus, but tells the cell, hey, make these little protein bits that are similar to the exact things on the surface of the virus. And then the immune system finds these things, starts to attack them, and develops some memories. So the next time when they actually see the virus, they notice these little spike things on its surface and then attack it. I mean, this is science at its most beautiful. The AstraZeneca uses another virus called adenovirus that is added into, the mRNA, the DNA in this case, the DNA in this case is added and piggybacked onto this harmless adenovirus, finds its way into the cell, and the DNA does go in the nucleus, instructs the nucleus to make mRNA, and then it's very similar to what the pure mRNA vaccines do. The reason I bring it up is it's the same idea. It makes little spike proteins, and the cell recognizes it when it comes across the virus. Now, the reason I pointed that out is it's already available in the United Kingdom, but the one that we're all waiting for is Johnson & Johnson, which uses the exact same type of technology, a different type of adenovirus that is modified and harmless, and it'll work the exact same way. The one value is that it's thought that this could be a single shot. All the other vaccines so far are double shots. Unfortunately, Johnson & Johnson is a little bit behind schedule. They may or may not release data as early as a couple of weeks from now. There's a couple of things to note. We're not sure exactly how this applies to pregnant women. Those trials are going on now. Children, the vaccine is going to start to be authorized for children above 12, and people who are very sick or otherwise immunocompromised. But one thing I wanted to make sure everybody knew is the vaccine really does apply to pretty much all age groups, all ethnic and racial groups, and all comorbidities. All these people were in the various trials. So it really does apply. In looking at the results, one interesting thing is that if you take the Pfizer, you do need 2 doses, but you already have some level of immunity in as little as 10, 12 days. So that's pretty good news. The Moderna wasn't quite so sure that you did, but their graph is not quite as sharp. But it is interesting that in slightly under 2 weeks, you can already differentiate and have some level of protection. Yes, there are side effects. I can attest to that personally. I had no side effects on my first vaccination. I got my second one, I deliberately put it to the weekend in case I did. And yeah, 12 hours later, I tossed and turned all night, felt very fluish, and then suddenly it goes away just as quickly. So I actually was heartened to find I had side effects, because it sort of told me that, yeah, this thing must really be working. Looking at the 2 that might be offered you, there is very, very little difference. I won't go through every line on this slide. What you need to know is if you're offered either of these, just take it. Don't sweat it. Both of these are 95% effective. And so they both have similar profiles, similar side effects and so forth, similar hypersensitivities. Just take either, or don't try and figure out which is better. I think we're going to hear later about how you can access the vaccine in the National Capital Region. Maryland is in phase 1B right now. They did healthcare workers and residents of nursing homes and first responders first. Now we're on to age 75 and people in K through 12 education. And as early as next Monday, the governor has announced we're pivoting to 1C, and that'll include adults over age 65 and a lot of essential people. More to say about what all this means, because that's a huge portion of the population. DC, I think, still remains in phase 1B, tier 1, which is very similar, with the exception that the age decreases to 65 instead of 75. Our components in Florida also have something similar to this. I know you're worried about safety, as is everybody, although we now have some experience. Although the trials only went out 2 months, I want to assure you that the patients in the trials, or the subjects in the trials, are actually followed out for up to 2 years to see what the potential consequences there might be. The truth is the trials are extremely safe. in terms of severe reactions were the same in the placebo group as in the trials as the people who got the vaccine. It's things like people got heart attacks and strokes and things like that. Appendicitis, clearly not related to the vaccine, and in similar numbers in two groups. People are worried about, well, what's in this thing? And it's about as pure as you can get in many ways. You got messenger RNA, some fats, lipids, and some potassium and sodium. If you're worried about putting this in your body, I wouldn't worry too much, because a lot of Americans put this in their bodies with all sorts of weird sounding names and don't seem overly concerned about it. Some people have questioned, hey, wait a minute, you're injecting genetic material into me. Aren't you going to change my genetics and cause cancer? mRNA is extremely fragile. It stays local. You avoid this immune response. It degrades very, very quickly, which is one of the reasons you have to handle it very carefully. And the Pfizer has to be stored at ridiculously low temperatures, like minus 70 Celsius, which is something like minus 94 Fahrenheit. I mean, that's just a big number. So I would not worry about mRNA. It doesn't go into the nucleus, doesn't cause much. Some people have a fair amount of vaccine hesitancy, and I'm not going to go through these numbers perfectly with you, but we're looking at death rates just simply by age group, not even necessarily by comorbidities. And so I did a little bit of side analysis here of if you decide not to get the vaccine and you want to remain alone, unprotected, and hope that herd immunity reaches you, well, you have about a 50% chance of getting infected, if assuming 50% get the vaccine. So that of everybody else remaining. And I'll cut to the quick here in the interest of time. The likelihood of dying from COVID if you did not get the vaccine and you haven't been infected yet, so you may or may not, but so it considers whether or not you're likely to get infected. Well, if you're ultra young, that's 1 in 40,000. If you're not so ultra young, it's about 1 in 200. And the likelihood of a long-term impact if you remain unvaccinated from getting COVID, if you do get it, is about 1 in 200. And then something like 1 in 20. Well, the likelihood of death or long-term impact from vaccine is imperceptibly higher than whatever happens to the general population. So if you're worried about something very bad happening because you're going to get the vaccine, it just does not compare to these very, very broad numbers. I'm going to try and preempt a couple of questions. Is the vaccine safe? I've just tried to address that. Which vaccine should you get doesn't really matter right now. Can you mix and match vaccines? Unfortunately, you can't because it hasn't been tested that way. If you don't want to get the vaccine now, can you get it later? Well, there'll be other types of vaccine available later too. So almost for sure. If you have symptoms, can I come to work? If you have a fever, generally you shouldn't because you don't know exactly what you have. But those kind of side effects last maybe 12 hours, maybe upwards to 2 days. So try and time getting your second dose in particular, where you might have a day or so off. When am I considered immune? For the Pfizer, it's 1 week after your second dose. Same for Moderna. The Pfizer requires their second dose at 3 weeks, the Moderna at 4 weeks. So somewhere around 5-6 weeks, you can consider yourself immune. But recall, only 95%, even in the best trials. So it's about 1 in 20 may not have perfect immunity, but even those in those trials that got sick had less severe disease, even if they did get COVID ultimately. We don't truly know how long immunity lasts. We're pretty sure it's at least 3 months. By most scientists, they think it's probably pretty good for a year. And depending on what the virus does over time, this might become kind of like the flu, where we get a yearly type of vaccine. If you're pregnant or thinking about it or have someone in your family, pregnancy is not considered a reason. I'm going to put in this double negative. Pregnancy is not considered a reason not to get the vaccine or breastfeeding. And in fact, being pregnant and getting sick with COVID increases your risk of a bad outcome. So I think if you have someone in your family, or this could be you, just talk to your OBGYN. Both CDC and the OBGYN various societies generally think pregnant patients should seriously consider getting the vaccine compared to the alternative. If you do get a reaction, when you get the vaccine, you'll get a piece of paper that explains everything and how you would report a serious reaction. Obviously, if you're very, very sick, you need to call your doctor or come to the emergency department. Almost all the vaccine programs watch you for at least 15 minutes. Just before closing, you've heard a lot about this variant virus from the United Kingdom. There's actually another one from Brazil and South Africa. The United Kingdom one is certainly more contagious, maybe 70% more contagious, but the spectrum of disease is not more severe, and it's felt that the vaccine should be okay. The ones that are originally in Brazil and South Africa, there's some concern that the vaccine isn't as strong, but it is felt that the immune response for the vaccine is so strong that even though this tries to evade it somewhat, it should overcome it. Only time will tell. 2 or 3 myths that I just want to dispel. Does the vaccine affect fertility? Not that's known of, and there's no reason it should. This was one of these ideas that spawned on social media because something that does affect fertility called the Synctin-1 has a spike protein on it, and people concentrated on this concept of a spike protein. And I want to reiterate about the serious impact on the mother. So if you're thinking of avoiding vaccine just for this, please don't do that. I've already had COVID. Yes, actually you can get the vaccine for one. We ask that you wait 90 days for 2 reasons. One, you have some level of immunity for 90 days for sure, and under scarce resource situation, we don't have a lot of vaccine, let someone get it who hasn't been infected and who needs to get the vaccine. But you should get it ultimately, even if you've already had COVID, and there's some thought that your immunity is actually stronger from the COVID than from the natural infection. Can you stop wearing masks and social distancing and all that stuff? No, not until herd immunity is achieved. Remember, 5% can still get infected, but the biggest reason is we don't know if you can still be a carrier. Remember, if you get vaccinated, you're immune from the symptoms. It doesn't mean that you didn't actually get infected and that you can't shed virus. So we should know in the next few weeks whether this carrier status is a big issue. So you're wondering if you have an allergy, should you get this vaccine? Because you heard of a few people have anaphylaxis. It's only recommended to fully avoid if you've actually had anaphylaxis to the vaccine or the things that are in it. There is a caution with people with severe allergies that we would watch them instead of for 15 minutes for development of symptoms for up to 30 minutes. People with anaphylaxis, what we really fear, it's literally within seconds and certainly minutes from an injection. A little different with food allergies like peanuts, which can have a bit of a delayed response depending on how it's absorbed, but this is a direct injection. So I will stop there, and I am pleased to introduce Hassan Zia. Whoop, what happened here? Okay. I'm pleased to introduce Hassan Zia and Leanne Sedone, who will talk a little more about specificity of exactly what we're doing with vaccine rollout in the National Capital Region.
Great. Thank you so much, Dr. Kellen, and thank you for your leadership and partnership with both Sibley and Suburban across this entire pandemic. I also want to take just a moment, and I think I speak for Leanne as well, to thank Carolyn for her leadership over the past several months since she arrived at Johns Hopkins and within the National Capital Region. It is so important to have a leader that can work across the NCR to best meet the needs of our community. The COVID-19 pandemic has truly demonstrated, I think, to everyone the importance of having quality healthcare available in our communities And I'm personally really proud of the role that both Sibley and Suburban have played in addressing those needs.
I agree, Hassan. We are just humbled to be here for you during this time. And I also want to thank the community for the outpouring of support to our hospital. We could not have done this without you. Your donations of PPE in the early days of the crisis, thousands of meals, cards, signs of support. We've had musical concerts, ride vouchers for staff, and hundreds of thousands of dollars to our Frontline Healthcare Hero Fund helped sustain our staff over the past 11 long months. You provided the resilience we needed, taking care of the people dedicated to taking care of you. And for that, we are enormously grateful.
Completely agree, Leanne. You know, it's really been an unforgettable year. Between Sibley and Suburban, we have successfully treated more than 1,600 COVID patients in our hospitals, and our numbers only continue to rise. For context, today we are treating nearly the same number of COVID patients as our last peak during the first surge, which occurred in late April and early May. But this go around, we are continuing routine care and surgery, which is different from the first peak where hospitals really around the country had to defer non-urgent or emergent care. Throughout the pandemic, we have had to respond quickly to changing science and changing community need, and really focusing on flexibility in the way we provide care for patients, both those with and without COVID. At Sibley, we have created a dedicated COVID-19 unit to provide all levels of care for these patients, essentially a hospital within a hospital in one location that is focused on providing staff with the training and support needed to care for these unique and complex patients. A key aspect of our response has been collaboration throughout the system. From very early on, teams from both Sibley and Suburban coordinated on our approach to meet the needs of our patients with COVID-19. We developed protocols for transferring patients to the location within the Johns Hopkins Health System best suited for each patient's individual needs, including sending those patients who needed the highest level of care to Johns Hopkins Hospital in Baltimore. Excuse me. This approach during the pandemic and beyond assures that patients have access to trusted experts and the most appropriate specialized care. We now understand that COVID-19 vaccine is at the top of everyone's mind and that our communities are eager for more information about vaccine distribution and administration. Across the country and in our area, the public vaccination process is being led by state and local health departments in collaboration with the federal government. In most jurisdictions, states have mandated certain criteria for patients to receive the vaccine. As many of you know, healthcare workers were the first population to be vaccinated in most states, recognizing that these staff members are essential for the continuity of care at hospitals. At Sibley, we have vaccinated more than 2,300 of our healthcare workers. The District of Columbia began vaccinating the general public last week. Johns Hopkins Medicine has started to administer the COVID-19 vaccine to patients who are age 65 and older and residents of Washington, D.C., per guidance from D.C. Health. A patient is anyone who has sought care with a Johns Hopkins Medicine provider within the last 2 years. Individuals who meet this criteria will be contacted via email when a COVID-19 vaccine appointment is available in the Johns Hopkins electronic medical record called MyChart. I want to emphasize community vaccination is randomized. For example, in DC, there are nearly 20,000 residents over 65 that have had a Johns Hopkins encounter in the past 2 years. Not everyone will immediately get an opportunity to be vaccinated. We release vaccine slots daily based on vaccine allocation from the District of Columbia. Johns Hopkins Medicine patients who would like to get the COVID-19 vaccine are encouraged to activate their MyChart accounts as soon as possible. MyChart is a secure portal protected by advanced encryption technology. Once your account is activated, and when it is your turn to schedule, a COVID-19 vaccination reminder will be sent through your MyChart, and it'll be entitled, "You have an appointment to schedule in MyChart." You can then access your MyChart account and schedule your COVID-19 vaccination. Please be aware that it could take several weeks after activating your MyChart account before you receive your COVID-19 vaccination scheduling notification. Johns Hopkins Medicine is working to distribute the vaccine to all eligible patients as quickly and as equitably as possible. We really want to thank you for your patience as we work through the large volume of patients who are interested in being vaccinated. Once you receive your first dose of the vaccine, you will receive information about scheduling an appointment for your second dose within the appropriate time frame. Information and plans about vaccination distribution are rapidly evolving. We are making updates about the Sibley process available on the sibley.org website, and so I would encourage all of our patients in this region to check our website frequently for new information. In addition to the option to be vaccinated at Sibley, residents of the District of Columbia who meet the DC health criteria can also schedule a vaccine appointment at a variety of locations throughout the District of Columbia by visiting the vaccinate.dc.gov website. More information from DC about vaccines and the DC appointment process is available at coronavirus.dc.gov/vaccine. Now, I know residents of Maryland are also eager to learn more about your state's vaccination process, so I'm going to hand it over to Leanne.
Thank you, Hassan. There's no doubt that this pandemic emphasized the importance of our roles as community hospitals, but also highlighted the value of being part of a sophisticated system like Johns Hopkins. As Hassan mentioned, throughout the pandemic, we all had to focus on quickly overcoming challenges to meet the changing needs of our patients and our community. It required creativity and the ability to be nimble and responsive. On March 2nd of 2020, Suburban opened a brand new 300,000 square foot state-of-the-art clinical building, marking the completion of a 5-year campus transformation. Little did we know that just 3 days later, the first COVID cases would be reported in Montgomery County. The timing was incredibly beneficial as it allowed us to quickly transform and reopen patient units to create dedicated COVID isolation units, as well as increase our ED and ICU capacity. The Suburban team pulled quickly together and worked tirelessly to prepare and respond. We quickly embraced our new norm of masks and face shields and isolation gowns. We constructed separate units for patient populations and installed special equipment to keep our patients and staff safe. At the most significant peak of the pandemic, we were running 5 COVID units. 2 of those were critical care with 80 patients. And over the last 11 months, we've treated 1,200 hospitalized COVID patients. As Hassan mentioned, we worked closely with Sibley and the Johns Hopkins Health System to coordinate the care of these volumes of patients and to also stand up services such as drive-through COVID testing centers on our campuses, and to coordinate resources, including supply chain and even some shared staffing. We recently launched an NCR float pool of nurses to address critical staffing needs. Looking back, it's been an extraordinary year and one that above all underscores an incredible team and community we have here at Suburban and throughout the greater Washington area. Now, of course, we're moving into a new phase of the pandemic. Our current numbers of COVID patients continue to reflect the data reported by the county in terms of rising positivity rates, but vaccines are a beacon of hope and provide a light at the end of the tunnel. We are also grateful that vaccines have been available to our employees. To date, we have vaccinated more than 1,800 staff across Johns Hopkins Health System in our vaccination clinic at Suburban Hospital. This approach is in accordance with the Governor Hogan's plan to begin vaccinations with healthcare workers and emergency responders. This process has been going really smoothly and effectively, and the staff running the clinic and the staff receiving the vaccines are positive and enthusiastic and oh so grateful. For the next phase of Maryland residents, just yesterday, the state began vaccinations for Group 1B, which includes those over the age of 75. At this time, Suburban Hospital is not a vaccination site for the state of Maryland or for Johns Hopkins patients, but we have provided space at our Germantown outpatient facility to help support Montgomery County patients in this critical phase. In addition, we are working very closely with our state, county, and health system leaders as plans continue to evolve. As Hassan explained, we recommend that all Johns Hopkins patients activate their MyChart account and also visit the Hopkins COVID website for updated information, including the list of Hopkins vaccine sites throughout Maryland. Of course, we also encourage you to visit the Maryland and the Montgomery County COVID websites to register and receive alerts that may include new information about vaccine sites and prioritization. As a nurse and a healthcare leader, I also have to take this moment to reinforce and reiterate the critical public health practices that Dr. Kellen outlined. After being vaccinated, it is so important that everyone continue to practice safety precautions that we've been following throughout the pandemic. Wearing a face mask, washing your hands frequently, practicing physical distancing, and monitoring yourself for symptoms. This will help keep you and everyone around you safe as we continue to move through this global health crisis. We know that you still have many questions, so I'll invite Dr. Kellen and Carolyn back on screen so that we can begin the Q&A portion of this session. Thank you.
Hi, my name is Kristen Pruski, and I want to thank our presenters for all of their wonderful content today. We received many, many questions in advance and during this presentation, and we tried to answer the questions that we had in advance through our presenters' presentations. You may continue to use the Q&A feature during the question and answer session, and we will do our best to answer as many as we can. Let's get started. Hassan, can you tell us about Maryland residents getting the vaccine in DC and vice versa?
Yep, I think that's a question on everyone's mind. And, I think we've learned through the first several weeks of the vaccination process that vaccine is being allocated by our public health departments based on resident population. So at this point, Sibley is only able to vaccinate DC residents as per DC health guidelines.
Thanks, Hassan. Carolyn, could you talk to us a little bit about the roles that the hospitals are playing in support of vaccine distribution?
Sure. I think it's important to recognize that hospitals, because of frontline care workers, because of equipment and facilities, were the first to receive the distribution of vaccines. But we are by far not the only ones, and we are partnering and collaborating with our public health departments and our state entities. It's important to recognize that vaccine is distributed to other institutions and organizations across regions beyond hospitals, whether that be federally qualified health centers, whether that be health departments. And as such, we are among a complement of institutions and organizations providing vaccine.
Gabe, could you talk a little bit about if you are vaccinated, if you can continue to spread the virus, even if you yourself aren't exhibiting symptoms?
Yeah, so current thinking is that that might actually be the case. And the trials that are looking at that are continuing to see just how much virus you may be harboring. And even if you do, is it enough to infect others? So there's a couple of nuances to that question. Just because you've been exposed and the virus attempted to attack you, you fought it off. There's obviously some virus in and around you, but it might be either so weakened or just not enough to actually cause infection. But it'll take a few more weeks till we have a decent answer to that.
Perfect. Along a similar line, Gabe, could you talk a little bit about the efficacy of, I know you talked about the Pfizer and Moderna vaccines, but we got some questions about the different types of vaccines and also about if your second shot has to be delayed, how does that affect your response to the vaccine?
Yeah, so current thinking is delayed is better than too early. And we know that to some extent by people who have been previously infected and they get a booster even after 90 days, like it's essentially their first dose. They were infected, they recovered, and they get the vaccine even well out from 90 days. They have a terrific response. So we know that they're reacting to the vaccine in a very, very big way. So the only reason we're doing this 21 and 28 days on these two vaccines that are available in the US right now is because that's how the trials were designed, to be able to get you immunized as soon as possible. It doesn't mean that if you missed the 3 week and the 4 week, and for some reason something happened and you got it at week 6 or week 8 or 9, or even 3 months later, that it's not effective. In fact, the current CDC guideline says if you've missed it, but you get it 3 months down the line, still consider that as your second shot. I don't want to encourage anyone to miss the deadline, though. You want to get immunized as fast as you can.
Absolutely. Hassan, can you talk a little bit about MyChart and just, you know, we've gotten a lot of questions about, I have a MyChart account, but I don't see anything. Can you talk a little bit about what people should be seeing in their MyChart account if they are over 65 and a DC resident specific to Sibley's vaccination plan?
Yep. So it's important to note that not everyone is going to get a notification to schedule immediately. It is in a rolling fashion based on how vaccine tickets are released. Once it is released, if you go into your MyChart, you will see an invitation to schedule your appointment. It is a little bit interesting that if you don't have notifications turned on in your MyChart account or on your MyChart app, it may not be something that comes to you as a text or an email, but we're also looking at alternative ways to communicate to patients that have received an invitation to schedule to supplement what's happening in MyChart and reach out in different ways. So at this point, I would say certainly check your MyChart. If you know how to turn your notifications on, please go ahead and do that. But we are looking at other ways to support that communication outside of notifications.
And I recently helped someone with it, and I know it's on the left-hand side of MyChart. So if you're checking on that at home, please look at that. Carolyn, we're talking a lot about MyChart, and there's questions from folks about some of our older adults or some of our other communities that maybe don't have the technology access. Do you want to talk a little bit about what Johns Hopkins Medicine is doing to encourage access for all communities?
Sure, yes. You know, certainly COVID-19 shone a very bright spotlight on health equity issues based on differential impact we've seen in different communities. So, you know, the first thing to realize is it is important and that we are committed to equitable processes. And we've internally done things like randomization and other practices to assure that we remove wherever we can biases in how we behave with regard to distributing vaccine. In addition, noting that it's important, we also know it's a great challenge. As you've heard, you know, the ability to access and work with MyChart is not something that is equally accessible to all communities. So we're also working with different resources and services to help expand the access to different communities. We even have partnerships locally in some of our regions to help support bringing vaccine access to those communities that we recognize are challenged. So it is a difficult situation. We are incredibly mindful. We're blessed. We have very smart people who for many months have been working through how do we do our best to remove our biases and to do what we can to broaden access. And of course, we are collaborating with our community partners throughout the National Capital Region to support access.
Thank you very much. Leanne, can you talk a little bit about why Suburban is currently not a vaccination site?
Sure. Our current vaccine clinic is not easily accessible to the community. So we want to be sure we set up things that are easy to navigate. So we're working with the other hospitals in the county to develop alternative sites.
Great. Thank you. I think, Gabe, could you answer this one? Can you talk a little bit about registering through a Johns Hopkins Medicine MyChart portal, and also should you also register through either DC or Maryland's websites for COVID vaccine eligibility?
So that's a great question. And I think the natural behavior is to register everywhere that you can, because at least in the state of Maryland, They don't have a centralized way of doing it, although you can go on the site and find out who's near you by putting in your zip code. So at Hopkins, we are doing two things, meaning in Johns Hopkins Medicine within the state of Maryland. Florida is a little different, and DC, of course, is just a tad different, but the concept is the same. If you meet a certain characteristic, and in our case, now that we've pivoted to phase 1B, it's age over 75. If you've had any encounter with a healthcare provider in Johns Hopkins Medicine in the last 2 years, you are automatically eligible to get this phase 1 vaccine. Now we have tens of thousands, even possibly over 100,000 such people. And we have exactly 1,000 vaccines allotted by the state for this purpose. So you can see that the math in and of itself is not very good. Messages went out via MyChart and email. And I think, as was mentioned, if you don't have the notification turned on, people will email us, hey, how come I didn't get a notification? Well, you have to have your notification turned on. Otherwise, your cell phone or your computer blocks it. To tell them that they're eligible and that they're automatically included. We do a randomization underneath the hood and then issue a number of tickets for the slots that we have. And when we issue a ticket, there's an instruction on how to go back into MyChart and pick an appointment slot at any one of our Maryland sites. And you do that and you get an appointment and it's confirmed, and the day before you get a MyChart reminder. We also attempted to reach all the people that don't have an activated MyChart, and it's amazing how many elderly people don't have an activated MyChart, like about half. And we're reaching out to them to try and make sure that they know about it and that they can get help in registering with MyChart. And then we have some communities that don't use MyChart, aren't on our email list, and might be more comfortable with a phone call. And so we are putting a special call center and outreach together to reach difficult communities, people who might have vaccine hesitancy, to do a special outreach.
I have one more question for you, Gabe. We've gotten a lot of questions about comorbidities, other diseases that people may have, and if the vaccine is right for them, allergies, you know, that's a lot of the questions. Where would you recommend people go for advice on if they should get the vaccine, if they have different comorbidities or allergies, or somebody even said about a past adverse reaction to the flu shot?
Yeah. So you can go to the CDC website for an overall view of this. And, you know, the comorbidities, and I showed this in the slides, the vaccine works for the vast majority of comorbidities. Some of you may be thinking that you have active cancer and you're on immunosuppressive drugs or you're on steroids or something. It's not contraindicated in those settings. It's just that the vaccine may not take hold as much if your immune system is depressed. There's no downside per se to getting it. If you have anaphylaxis to something, it is still okay to get the vaccine. You will be watched. Make sure people know, because you need to be watched instead of for 15 minutes, for 30 minutes. If you're worried about the allergy issue, or you have comorbidity that you're not sure was included in these trials and so forth, reach out to your doctor. If you have an allergist, reach out to your allergist and get more specific advice. I obviously can't give out medical advice in a very specific way here. So make sure you contact your healthcare professional.
I think one last question, I'm going to ask it again to you, Gabe. There's been some questions about, should I take Tylenol before I get the vaccine or immediately after? And also any tips that you could provide about activities to do or not do after you get the vaccine. Can you start exercising immediately, along those lines?
Yeah, so you can take it preemptively if you like. No big deal. You know, there's some nonsense out on the internet that Tylenol interferes with the vaccine. No, it doesn't. Same with NSAIDs. You don't need to worry about it. Take it if you want to take it ahead of time. Fine. It works pretty quickly, and not everybody gets symptoms, so it's also fine to wait. I'm an N of 1, so not the best example, but I got my shot Saturday morning, and at noon I went for a 10K run, and didn't have any side effect. You can do whatever you can do. And just carry on with your life. Almost everybody has soreness in their shoulder. That's just a given, first and second dose. Last a couple of days or so, but otherwise, don't change anything. The only thing I've cautioned is in case you may not feel well enough to go to work the next day, if you can arrange your second shot within a window where, just in case, hey, I could lie around for a day or so and just take it easy. But you don't need to restrict your activity.
Thanks so much, Gabe, and thanks everybody. We will be sending a recording of this event out afterwards with more information. And Carolyn, if you could just wrap things up for us, please. Thank you.
Absolutely. Well, thank you to all our panelists for the important information that they have shared and for addressing attendee questions today. Thank you to all of you online here for watching the webinar, for being part of our first NCR webinar, and of course, for your continued support of Johns Hopkins Medicine. We are grateful for the confidence you place in us for your medical care. In the next day or so, you'll receive an email that has a link to the webinar. Please feel free to share it with family and friends. And please remember that the best source of the most up-to-date information is the Hopkins COVID website. Please do take a minute to complete a short survey that will pop up on your screen as you log off the webinar today. Your feedback will help us very much in terms of identifying topics and plan for future webinars. Thank you again for spending time with us today. And I just ask you to consider that this is a transition time in our country that so many of us hope is marked by kindness and inclusion and understanding. Please know that the challenges we as your hospital and health system leaders face is different and beyond what we faced at any point. And honestly, that makes your support and your generosity all the more valuable and important to us. So we're very grateful for that support. It is more meaningful than ever. We thank you for being with us, and please stay healthy and well.